I think it's really important that we take some time to celebrate where we've got to. We've made huge progress in a very short period of time. There has been a significant amount of pain, but also a lot of achievement along the way. So by all means, let's celebrate our success. I can't think of a phrase that I can say on camera to describe, though, what I also want to be talking about today, which is that actually Swaran introduced us as being at the beginning. I kind of think we're reaching the end of the beginning. I had to make sure I got those words the right way round, because we really haven't fully achieved anything yet. We will have achieved something when we reach 2015 and IAPT services are fully integrated. We have a wonderfully skilled and highly available workforce, and we're putting people through the service with the rate and with the speed of access that we would want them to be able to achieve. So I kind of would like to develop Swaran's phrase of we're at the beginning by saying, actually, I think we're coming to the end of the beginning. We need to start thinking about what we need to be doing for the next phase. For those of you who are just about to embark as Year 3 sites, I'm sorry that we're kind of pushing on a bit, but actually I think it's absolutely fundamental that we start to consider what do we have to do to ensure that IAPT services are sustainable into the future. I can beat 1998. My father was a director of public health for many years and gave me an article about a year ago that he wrote in 1968. And he said in this article, which was published, I think, in the Journal of, whatever it was at that time, Journal of General Practice, that mental health care should be embedded into primary care. It should be embedded into the work of community healthcare staff. And of course, there have been lots of ways in which mental health services have developed over the years, but he decided to use this as an opportunity to demonstrate that he was 40 years ahead of the game. So obviously I kind of gave that due reverence and respect. But it has been talked about a lot, and here we are at the opportunity. We now have the opportunity to really make this happen. And great to get some of the figures to demonstrate that we're doing that. What I was planning to do is just give you 5 nuggets, to use Jenny's term, really just 5 areas that I think we need to be very mindful of as we move forward with IAPT. The first is, let's get the fundamentals right. Let's not run before we can walk. And I think I've just listed some of the fundamentals. You'll hear a lot more from Mark and Kevin, who've actually been going out talking to people about, well, what worked for you and what didn't work. But I think we mustn't lose sight of the fact of what fundamentally IAPT is all about. And I've just listed some of them here. So it is about ensuring people have quick access to services. It's about being outcome focused. It's about making sure that we're constantly monitoring how effective the services are. It's about stepped care. It's about measuring what do we do well, what does IAPT do well, and let's keep doing it. It's about having well-trained, and given that some of my staff are sat here very close to me, at the very front of the room, very well-supported staff. Look after your staff. I'm not just saying that because they're here, but actually, as with any service, the workforce is fundamentally what we've got to offer to people. So we do need to make sure that we continue to nurture and develop the workforce beyond the initial training year. It's about being integrated, and it's about setting up mechanisms for managing knowledge, managing communication systems to ensure that everybody is as well informed as they need to be about IAPT and about how it's developing and how it's evolving. My second key nugget is we can't afford to stand still. In Coventry and Warwickshire, our PCTs are very keen to have a celebratory event to really allow the people of Coventry and Warwickshire to see what we've set up. I've been quite resistant to this because actually I'd quite like to be doing that in a year's time. I think we may have something that we do, but fundamentally I don't think we can afford to actually stand still, pat ourselves on the back for too long, because we've got a really major job on our hands for the next few months. We've really got to, as Swaran was saying earlier, we've really got to do all we can to evidence the value that we've been talking about from IAPT. We now have to pull that evidence together. We need to think beyond KPIs. The KPIs are what's required of us in terms of the minimum data set, but will the KPIs really be what will influence your commissioners, the people who are going to be funding IAPT services, that this is of value? I suspect not. So what we need to be doing is making sure that we're gathering the data that's going to influence decision making about future funding for IAPT and how we present that data in a format that actually is meaningful to people. And so I've kind of put up their KPIs plus. We do need to be taking a local view of what is the kind of data that's going to influence those decisions. We do need to, and I know we're doing across the region, a lot of work in trying to ensure we can engage GPs better. Are there any GPs here today? No. We are running some special events for GPs. It is quite difficult consistently across the region to engage GPs, to get GPs to champion IAPT. You can speak to GPs and you'll get a lot of very positive views about IAPT, but it's quite difficult to actually engage them proactively in helping you to develop and expand services. So that's a challenge for all of us. Once we've trained our workforce in delivering CBT interventions to people with anxiety and depression, we need to be thinking about, well, what next? What's there for that workforce? How can we use that huge amount of skill and competency to good effect in our locality? And that's going to vary. We need to be flexible and responsive to what each locality has to offer and to what each locality needs. We need to be thinking about growth opportunities. Again, we need to have sustainable funding to keep IAPT running. We also need to be looking at how it's going to grow and develop, and that might be about looking at commercial opportunities. Might be looking at ways of delivering IAPT in other settings, outside of healthcare, outside of employment streams. And we need to be thinking now about what our dynamic business proposals are going to look like for IAPT, and how we pull all of this information together and present it, who it needs to be presented to and in what format. So not standing still is my kind of second nugget. Leadership is the third area that I think we need to be spending a lot more time thinking about and focusing on. We have been looking nationally at how we can develop leadership skills within IAPT across the country. But actually in the region, there are lots of different examples of services that have had very clear, dedicated, knowledgeable leadership and how successful that's been, and other areas nationally where perhaps that hasn't been prioritised and things have been more difficult and more challenging. So we need leadership within IAPT to be knowledgeable, to be competent, to understand the concept of IAPT. It's not just about running a clinical service, it's about understanding the whole culture of care that IAPT is trying to embed within our systems. It's about having leaders who are valuing and respectful of the roles of the staff and the people who are delivering IAPT. It's about leaders who can be influential with commissioners, who can actually have good relationships within their organisations and also outside of it. It's about managing knowledge more effectively. This is something that certainly my understanding has grown over the past year. We gather an awful lot of information as we're going along. IAPT is a classic example of, probably one of the best examples you'll get in healthcare, of we're gathering a lot of information about this. We need to make sure we manage that information skillfully and meaningfully.